our purpose. So we are here to spend some time together this afternoon to learn about the vital conditions framework. And this is something that's really been instrumental in our work here at Interact for Health. We've adopted this framework and used it in developing our health and our opportunity report last year. And before we dive in, just want to share a little bit about how we are using it, and also to acknowledge that we're in a tough time as a community, as a country. What many of us are spending our time on is not what we expected to be spending our time on right now. And I imagine, and I know sometimes there's a tension with, we're feeling such a sense of urgency to respond to things that are going on, and it's hard to take a step back and think about mindsets and frameworks and spend time really dedicated to this. But I want to urge us and kind of call us that this is especially important now, when we are in a moment where we are so polarized as a community. Understanding how we can use common frameworks and language that pulls us together and undergirds our work around our shared humanity is so important. And so we really believe in that, and that is a big part of why we've adopted this framework and used it in our report here as well. Next slide. And just to remind folks, what underpins our work here at Interact is a belief that every person deserves the opportunity to live their healthiest life, no matter who they are, where they live, how much money they make. We all deserve that opportunity. Next slide. And our region, as everyone on this call knows, we are made up of many different individuals. Many of us fall in different ones of these circles you see here. There are 2.4 million people in the greater Cincinnati region. And no matter which of these circles we identify with, we have a shared common humanity, and we all deserve respect and well-being and dignity. And one of the exercises we've gone through as an organization, and I love our chat here today is reflective of this as well. When we ask folks, what are your hopes and dreams for a thriving community? There is so much commonality, no matter what neighborhood someone comes from or what community they're part of. We have a desire for support and unity and access to resources and green spaces and safety and family. And so that, just to remind us that that's what this is about. It's lifting us up and framing around what are those common visions that we have for our community. Next slide. And at Interact, we are constantly reminding ourselves that our community's health is not the responsibility of any one individual or any one organization. It is our collective effort. And how do we understand how each of us can help contribute towards that common vision of our community's improved health? And so as we go through the vital conditions framework today, I just want to remind folks, these are the 4 themes that came up in our health, in our opportunity report, and they're very much part of the vital conditions framework. And so with that, I'm going to hand this over to my colleague, my amazing colleague, Ashley Young, who is our Vice President of Policy and Community Engagement.
Thank you so much, Kate, and good afternoon, everyone, on this sunny day in Cincinnati, Ohio. The sun is bringing me joy today, and the warmth is bringing me joy. And so thank you all for joining us so much. And so it's been an amazing time really working with the Rippel team as we continue to just really dive deeper and understand the vital conditions for health and well-being. And I absolutely positively just love the framework. And I really feel like it helps us shift the stories that are told all around us around health and well-being. Really by understanding community conditions, not personal lifestyle choices, profoundly shape our health. And we can move from this fatalism to more optimism. And we can also shape those conditions to move from health inequity to health justice. and moving our mindset so that we're thinking more collectively around our health and really focusing less on individuals. And so I'm really excited for us to dive deeper collectively as a community today to the vital conditions. And so I'm extremely excited to welcome the Rippel team. We have Anna Cregan, the Director of Systems Change, Veranda Sood, the Program Associate, Bobby Milstein, the Director of Systems and Strategy. And so without further ado, I will turn it over to them. Thank you all so much for joining.
Thank you, Ashley and Kate. It's great to be with you all. For today's session, we're going to introduce the vital conditions for health and well-being, what it means to move from scarcity to abundance, and introduce the four key drivers of well-being in the well-being portfolio and how we can all see our work in that. I just want to start with some background on Rippel and our vision, which we share a lot of values with Interact for Health. We join with others to realize a unifying and measurable expectation of all people and places thriving together, no exceptions. We know our health and well-being relies on a system that is not yet built for everyone to thrive. But these fraught systems can be transformed through the practice of shared stewardship. And I'll talk a little bit about stewardship later on. We share and talk about the vital conditions because it helps folks shift the way they see their own work. We're hearing from folks in the field using the vital conditions and the impact it has on their language, using a shared vocabulary, and their culture. As mentioned, thriving is a unifying and measurable expectation. By measuring it, we have a better sense of the picture of how many people feel like they're thriving, how many people feel like they're struggling or suffering. And if we break it down by race and ethnicity, we see that as of recently, but the percentage of thriving hovers around 50% across these populations, which only reinforces that in order to move towards racial equity, justice, and well-being, we have to transform our current systems. And zooming in on the local feelings of thriving, from the national to the local, we see here is some recent data that gives just a snapshot of the sense of thriving in Hamilton County, Ohio. Specifically, we're looking at the percentage of those who anticipate a better life 5 years from now. And you can see there's great hopefulness for a thriving future in these numbers. Focusing on the collective optimism can ground us and help us think about the different possibilities that can emerge. So what do you think? Just from seeing the national and local data and hearing what it might take to realize this vision of thriving, how does this statement resonate with you? The greater Cincinnati can become a place where all people thrive together, no exceptions. Take about one more second or so. I think we can share the data. Thank you. So we see kind of like a range of answers, which totally in this moment, as Kate was saying, it's might be hard given the moment. But in a world of like increasing uncertainty, we have to choose and see the hope and the momentum. Hopefully we can side with the optimists here. And so how do we move from hope and optimism to action? It takes stewards, folks like everyone on this call, your neighbors, organizations, networks that work with others to create the conditions that we all need to thrive, beginning with those who are struggling and suffering. And everyone can be a steward. Across the country, we've seen stewards rising to meet this moment, bringing others together to create big and small wins that work towards this common goal of thriving together. And here's Greater Cincinnati. So, what are the vital conditions that stewards are trying to create, and what does it mean to organize around them? These are the vital conditions: thriving natural world, basic needs for health and safety, humane housing, meaningful work and wealth, lifelong learning, reliable transportation, and belonging and civic muscle in the middle. A lot of this you all said in the check-in, and that's great. And I really want to just double click on belonging and civic muscle and why it's in the middle for 1 second. Belonging and civic muscle is at the center because it is both a vital condition in and of itself and also a practical capacity that's necessary for equitable success across all the other vital conditions. Belonging and civic muscle are always needed to ensure the effectiveness of all the other vital conditions. And so these are the conditions that we all need and is a way to help individuals and organizations across places and sectors to see their role and the potential for contribution. We'll dive a little deeper and share the definitions of these vital conditions in the chat. But this is a framework that to help ground us and bring us together during times like these. As we're seeing systems collapse, people can rise and transform the status quo. So another quick poll. We'll get a pulse check from folks. Before the webinar, how familiar are you with the vital conditions for health and well-being? One more second. You can share the results. So we have a range of folks who are acquainted with the vital conditions, who are not familiar, and that's great. This webinar is meant for you just to get more acquainted with it, see how your work can fit in with it. We're going to just introduce the vital conditions with a quick video from our colleagues in Healthy Communities Delaware that really helps to visualize what we mean by the vital conditions and how it plays out in communities across the country.
Our health and well-being are shaped by the communities where we live, learn, work, and play. Vital signs like heart rate, temperature, and weight tell us about our body's health. Vital conditions tell us what is going on in our community and in the world around us. Vital conditions are the things that we all need all the time to be well, thrive, and reach our full potential. Basic needs for health and safety include access to fresh air and water, nutritious food, a stable home, and access to healthcare services. A thriving natural world means clean air, water, and land. A healthy environment is free from dangers and fulfills our needs to connect with nature. Humane housing is having safe, secure, affordable, consistent places to live. Meaningful work and wealth includes well-paying and fulfilling jobs, financial security for our whole life, and wealth to pass on to future generations. Lifelong learning provides ongoing access to quality education from early childhood to adulthood, ensuring that all people are set up for success and have the chance to reach their full potential. Reliable transportation ensures access to work, school, healthcare, retail, and other needs of daily life. Belonging and civic muscle is being an active, valued part of a community and having the power to help shape its future. Community vital conditions are different from personal experience because they are connected to each other and persist over generations, shaping the choices, options, or challenges that we encounter in our lives. If any vital condition is weak, we start to see illness, unemployment, homelessness, food insecurity, loneliness, and more. By making these vital conditions stronger for everyone, we can realize equitable, thriving communities for generations to come.
So hopefully that video gives you a good sense of how the bio conditions can look in a place. I know when I first saw that video, I really felt like this is it can be very simple, and we can see how our neighbors, how our friends, how our family, all of us can fit into creating what a thriving future looks like given these bio conditions. There's a role for all of us. So we've known that we need certain conditions for collective well-being for decades, and now we have an actionable framework that goes against the grain of solely just reacting to problems, but building an infrastructure that weathers through the uncertainty and fear. Communities, organizations, and individuals across the country have used the framework to bring in others, join together to leave behind inherited conditions to create new ones. As we are born with certain conditions, we also want to leave behind conditions for well-being for generations to come, for our children, for our grandchildren. And I specifically want to again highlight the dual role of belonging and civic muscle and the important role that cannot be overlooked as they reinforce each other and are important to the effectiveness of the other conditions. Belonging is feeling like part of a community, embrace for who you are and valued for what you bring. Civic muscle is the power of people in a plural society to work across differences as stewards of an equitable and thriving future. They work together to build shared power for well-being and justice. And by prioritizing both, we find new ways of being in community with one another and what community can look like when we are living into that shared power that we all have. And we have seen so much momentum from partners across the country, from the federal level to the grassroots level, are seeing themselves as part of a whole to create the bioconditions for health and well-being. People across organizations and levels are using the shared vocabulary and organizing around a vision of thriving together. And so these are the definitions. We also have them in Spanish for wider accessibility. And thank you, Anna, they're in the chat. And before we go into stories of how people are using the bio conditions local and across the country, I want to touch on this last point. I'm sure a lot of you are very familiar with the social determinants of health and are seeing similarities and differences between SDOH and the bioconditions framework. We see the bioconditions framework as building and expanding across the social determinants of health. Ultimately, the bioconditions unify us, our neighbors, our partners, and others across many sectors to act on and contribute to creating the conditions that we all need to thrive. I'm now going to pass it over to my colleague Anna, who will highlight a few stories to show how partners did just that.
Thanks, Brenda. Great. Yeah, so I'm going to share just a couple stories of how folks are kind of digging into this. And you can go to the next slide. So the first thing that the Vital Conditions Framework really helps us to do is think about the conditions of all the communities that we're currently living in and think about them as sort of legacies left to us by generations before us, right? All the different generations, all the decisions that were made. That is the sort of conditions that we're living in right now. And we have the opportunity to think about how we can invest and make decisions differently and be good ancestors for generations to come, right? What can we leave for others so that the conditions and communities are better than the ones that we're living in today? And some of the champions who are using this framework are really showing us how to counter racism and other forms of inhumanity with love, and really combining that with the belonging and civic muscle, which is at the center, right, the sort of core vital condition, that are necessary to actually create systems that are fair for everyone and designed to sort of create fairness, as opposed to the ones that we currently have, which often create unjust systems. Next slide. And so, you know, just to connect this to sort of the public health piece and the justice piece, you know, justice is what love looks like in public. And this is just a really fun quote, sort of really for us, sort of brings to light why love is so important in this, even though sometimes people think of it as, you know, touchy-feely, right? But it's critical to the work that we're doing here in terms of creating vital conditions for everyone so that all people and places thrive, no exceptions. We're not leaving anybody out. Next slide. Okay, so one of the ways that we sort of operationalize the vital conditions is to put it in the context of a regional portfolio of investments, right? And it's not as simple as a sort of bank account investment where you can just move things around and make, you know, decisions. It's much more complex than that. There's many different organizations, many different people, government, business, community-based organizations making decisions every day that create this regional wellbeing portfolio. But it helps to think about, on one side of the portfolio are the vital conditions that Brenda introduced, things we all need all of the time. And on the other side are things that we all need some of the time. You know, when we get into an accident, when we have a baby, right? We want to have our sort of services that we're going to need, acute services. There's always people in our communities who are going to need acute care for, you know, addiction treatment, crime response, environmental cleanup, unfortunately happening more and more, you know, homeless services, unemployment and food assistance. These are things that some people need some of the time to get back on their feet, sort of establish their well-being. And so we want those. We don't want them to go away. But what has happened over the past decades is sort of crisis after crisis and underinvestment in those vital conditions in our communities is sort of overinvestment in these urgent services. And what that means has sort of like an imbalance then of our portfolio. And what we know is that we can't sort of invest our way, can't urgent service our way to thriving in our communities. And so the question is, how can we sort of rebalance back to really investing in those things that are long-term, sort of generational commitments to well-being in our communities, all while still having the adequate urgent services that we need when we need them. Next slide. And an example of a community that's really investigated their investments, in particular around behavioral health efforts in their community, is Palm Beach County, Florida. There's a group called Be Well PBC, sort of a collective impact effort that's brought together many of the large funders around behavioral health and a lot of community-based organizations to think about, what does this mean for us in our community? And they were able to first identify, use the vital conditions as an organizing framework, and then together identify belonging and civic muscle as the thing that they wanted together to focus in on and think about, how do we build belonging and civic muscle to impact greater behavioral health in our community? And importantly, how are we thinking about investing in generational change, right? Thinking for generations ahead, not just for the next sort of 2 to 3 years, although of course that still happens and is important. Next slide. So as I said, sort of really focused in on belonging and civic muscle. And one of the things that they did in order to think, well, how are we going to do this? Is they came together, and you can click again, Brenda. They developed what they're calling the simple rules for building belonging and civic muscle. And if you look at them, you know, listen, share, innovate, connect, commit. It's not rocket science, right? These are things that everybody can do. But really it's a way of signaling a commitment to each other to work together differently in all aspects of their work, internally within organizations and externally with partners across the community. And so today, this, you know, years later, this is like 5 years after they develop these, they're continuing to bring new organizations, new people into this way of working together and saying, will you commit to think about these commitments or these rules when you're making decisions about what initiatives to make, what programs to invest in, who to partner with. And together as a sort of broad network now of stewards across the community, all together in this movement of how do we build belonging and civic muscle together. So it's a really fun effort to sort of see over time how they've grown this movement. And we can put in the chat sort of a impact report that you can take a look at, which is interesting, as well as a video of some of the folks who've been really involved in the effort. I won't play it just for time's sake right now, but you can take a look at it. We'll put it in the chat. Next slide. Here's just a picture of the some of the folks who are in that video. All right, next slide. So to dig a little deeper into this wellbeing portfolio, we're going to focus in on some examples from Greater Cincinnati. You can go ahead and go to the next slide. And in a fun coincidence, although probably not a coincidence because of the really great work that these groups are doing, so it makes sense that we both found them. But about a year ago, I was introduced to Dr. Meredith Smith of Queens Village, and the goal was to come together and write a paper using the vital conditions as an organizing framework to think about efforts around perinatal well-being and reproductive justice. And so we came together and wrote this paper, and we highlighted the work of Queens Village and Mama Certified as a example of efforts that are not only focusing on, importantly, the sort of basic needs for health and safety as one of the vital conditions, right? Access to holistic, culturally appropriate, affordable, primary care for birthing people, but also building belonging in communities, helping folks in these communities feel like they belong, using a collective approach, building community leadership, and really celebrating Black women in the work that's happening. So really a great example of building belonging and civic muscle in your own community. Next slide. And another example that we just found through the report that Interact for Health shared with us, but looks like a really, really interesting effort, is Found Village. And again, the focus here is really about bringing people together, creating that sense of belonging, and building the sort of the civic muscle, what we call it, sort of the agency, the sense of power of youth in particular, to work towards a greater, sort of more impactful future together. And I think we probably have some folks from some of these efforts on the line, so it'll be fun to hear from them as we get into breakout groups and discussion. Next step, next slide. So we're gonna, in a couple minutes, get into breakout groups, and we're gonna have you do an activity using the wellbeing portfolio. But before we do that, I just want to get our juices flowing and think about, I shared 2 examples. Think about your own work or someone else's work that you know really well, and share an initiative or a program that you see, that you're doing, and think about which vital conditions and urgent services that initiative's touching. And you can just try to put it in the chat and kind of begin to think about the work in your region.
Welcome back, everyone.
Thank you, Caroline. So I was just going to sort of open it up to hear, what did you all talk about in the different groups that we were just in? Brave souls. Share out. I will tell you at some point, so.
Well, this is Rebecca. Just our group it was interesting because I think we all sort of felt a little awkward. But within that awkwardness came a lot of wonderful revelations about the kinds of things that each of us experience in respect to the work that's being done in our communities, and connecting the dots in regard to the vital conditions as well. So I think it's always inspiring when you come together on these calls and you're somewhat unsure, and then each of you have a very great, if not outstanding, example of those key points that we're trying to understand and learn from. So I thought it was very worthwhile.
Thanks, Rebecca. From other groups.
So, hi, this is Renee. So in our group, I think what we really came upon is the fact that the conversation is probably a little reverse when we think of vital conditions, meaning that we figure out how people choose to come together. And then that comfort in whatever that dynamic is. I think someone from Talawanda talked about group of community members that came together with their old high school yearbooks. They live in the same community, and that was the starting point of the conversation that then evolved into the bigger conversation that we're describing, which is the vital conditions, versus kind of saying, here are all the factors that contribute to your health outcome. And really letting the people in the community, whatever that community is. I know Kate referred to, the work with HAY and the work with our youth fellows, and them driving the conversation that then further informs the bigger goal that we're all really coming together, which is looking at what are the barriers in having, mental health accessibility, or understanding what that dynamic looks like for a young person versus an adult or senior in our community. So I think that was something that we talked about, just kind of how you frame that conversation, how you then use the conversation to drive the direction for the community.
Love that. Thank you. Others? Dee, can I call on you? Because you had a lot of good things to say in our group.
Sure, absolutely. We spoke, or I spoke about what Miami University Regionals, what we're doing there this past year. I mentioned in my chat introduction, I work at Miami University Regionals, and I do research and am chair or co-chair of the Regionals Health and Wellness Steering Committee, not just for students, but also for faculty and staff. And we are working with a generous grant from Prevention First and community college health. And we're doing the things that we're doing are addressing the basic needs. Also, I forgot to mention this, Anna, is we are promoting the resources that we do have on campus. So in other words, in our assessment last semester, we did a lot of assessment, and I hosted a World Cafe on student well-being. And we learned that students and staff and faculty are largely unaware of the resources that are right there on our campus. So we learned about that. And we learned about what their needs are: transportation, food. These are basic needs that will keep a student from being successful. And that is my passion. It's also my research thread. So I research branch campus, specifically branch campus, mental health and well-being, because that is important for their academic success, so that they actually graduate and do not leave with more debt and no degree. So that is a priority for me, and we're trying to restart our peer health educator program. We're re-envisioning what that might look like. Right now it's a student organization, and it is largely inactive because it is run by nursing students who are ridiculously busy and stressed, more than any of our other students. So it really has been difficult to get that off the ground. But we know that our students, because they've shared that in the World Cafe and in qualitative or quantitative surveys, we know that they want to be educated by their peers. Apparently, I am too old to educate them. on certain things, which is fine by me. So we're working really hard. And I was also sharing that I am a faculty tenure track. I go up in the fall, so any positive vibes you can send my way would be greatly appreciated. And it has been an incredible honor. I think we've learned a lot this year. This is also a great workshop for me to be in. And we're starting to get some traction. So I feel good about that. And this may help us to finish up and move forward next year with really impressive hopefully progress on that. I'm really excited about it. Also, in case you haven't seen it, I'm plugging this, like, it's a nonprofit, but if you've never heard of or seen the musical called She's Crazy, have y'all heard of that? Oh my goodness, it is the best. It is to decrease mental health stigma. And I didn't like the title of it, but it's a powerful thing. You laugh, you cry, and at the end, they all talk to the audience. We are hosting it. We hosted it with the Fitton Center for Creative Arts and Vision Partnerships, which is our community partner, and it went over really well. And we're hosting it this time on campus, but it'll be online. And that's gone a long way. And of course, with that, we are promoting our robust counseling services.
Great. Yeah, thanks, T.
Yeah.
So hearing all the things, there were so many different vital conditions that her work is touching in terms of lifelong learning, and all of the things that barriers and challenges around that in terms of transportation and cost and everything that sort of folks encounter, as well as thinking about how do you make a cohesive sort of student body when it's not everyone's a commuter, right? That's a big challenge. And so thinking about how to build belonging and civic muscle, and thinking about stigma, right, as related to mental health as a huge barrier, and again sort of really related to belonging. And then, of course, basic needs are, through focus on nursing students and peer health education and access, to primary care. So really touching so many already of the different things. And you said you're just getting started. So, so thanks for sharing. I got a tip that Danielle, I'm sorry, is it Danelle Hupp?
Hi,
From
it is.
Bobby's.
Hi, Danelle.
Hi, Danelle. I love your puppy. From Bobby's group had a good story. Can I ask you to share?
Of course, and I apologize. My camera is not being recognized by the computer, but thankfully for your viewing pleasure, you get to see something far cuter than I. That's my little guy. So I'm Danelle. I'm with the Best Practices in Schizophrenia Treatment Center. I'm actually up in Northeast Ohio. But we have one of our first coordinated specialty care for first episode psychosis programs in Cincinnati, and they cover such a wide area of Cincinnati, the whole greater Cincinnati community. And as I was thinking about this, I'm so grateful to be here today because I love this model and thinking of, it sort of reframes a lot about, how I do our first episode teams. But, obviously on the urgent side of services, so these are individuals who are experiencing early psychosis. And so, intervening as early as possible. So oftentimes, unfortunately, that involves hospitalizations or intersections with the criminal justice system. 50% or more of individuals with a serious mental health condition also have a substance use disorder. And so, on the urgent services side, the coordinated specialty care model is really about wrapping that individual's community around them and services around them. And so, the unemployment one really stands out to me on the urgent services side, because the goal is always to get individuals back to living their best life and being a contributing member of society, and reminding them that they never lose that sense of purpose and responsibility to others and that sense of community. If those individuals don't, it's very hard to be motivated if you don't feel like you're part of something greater than yourself. And so having that opportunity to, build those connections, rebuild connections or bridges that have been burned, getting right back to school or work or whatever that is to be a contributing member of society, and just having that sense of belonging and purpose and feeling that sense of self-control and empowerment again after feeling lost for maybe a year or two, early in their psychosis. I think this is just a really powerful way, kind of brings it to life, but we do have supported employment, and education services, obviously making sure, part of the wraparound model is making sure those basic needs are met, because if those aren't met, it's really difficult to be invested in any kind of treatment. And then, that meaningful work piece, work as in, job, career, but also I think meaningful work just as a human being and being part of the larger community. So, yeah, I really appreciate this model, and thanks for letting me butts in today.
Yeah, thanks for sharing. Yeah, really important work, and that that belonging, really the sort of being valued for who you are and what you
Yeah.
offer, right? It's so important and critical to all pieces of this, right? We can't just have our vital conditions over here if we don't have everyone sort of feeling like they really can contribute meaningfully.
Yeah, absolutely. I think that values discussion is something that's really critical to the work, because if you don't, it's great to have treatment goals, but if they're not connected to things that are valued or meaningful by that individual and how it ties in with the greater community of the larger community, it's really hard to be motivated for change, or for wellness. And so, yeah, great model. Thank you. Thanks for letting me share.
Thank you. Let's see, I'm gonna wrap this up in a couple minutes, but I want to make space. Stephanie, did you want to talk a little bit about what you put in the chat here? If you don't, that's okay too.
I can't speak on the other agencies. However, we had Cincinnati Children's in there, and a few other nonprofits as well too. But they were just talking about some of the initiatives centered around helping the youth here in Cincinnati. And then myself and my colleague, her name is Rashida, we talked about one of the initiatives that we're working on at Planned Parenthood, centered around Black health equity, specifically for Black women, and just centering those voices, making sure that if we take a focus on the needs of Black women, how that will change healthcare, and not only healthcare, but the communities around us as well. So we talked about things like that, as well as partnership, what partnership is looking like for us in this ever-changing world of moving away from DEI and those things and those difficulties.
Yeah, such a challenging time, so I appreciate sharing that and the work that's happening. Any comments from the Interact for Health team that as you were in your groups and hearing things, or just from what you know that's happening in your region?
I can share a little bit. Rebecca from our group already shared some of what we talked about, but I also shared an example with one of our new partners, Newport, which is focused on the west side of Newport specifically, so in northern Kentucky, and really feel like they are embracing this model and looking at the whole of the community. They are an organization of one and are really driven by community and have community representation at every level. I really feel like they're embracing the civic components and democracy at the center of what they're doing, and they're, focused on housing. They're looking at what their kids are walking by on the way to school, what they're experiencing in their environment. There's a metal scrap facility that's been doing some questionable things that they've been trying to tackle, looking at things like community benefits agreements when there is redevelopment, because they know there's some prime real estate that is going to potentially be redeveloped. So how do they ensure that the community has a voice in that? So I feel like they really are embracing this model, whether they know it or not, and focused on the whole of the community.
Yeah, thanks, Megan. It's a great example. And, I think that is the work is already happening, right? And so this isn't to say, here's how to do the work. It's more, here's a framework to help sort of organize a lot of the work and some language that might be helpful as you're out there talking about this work with different people. So that's a great example. Thank you. Okay. Well, with that, I'm going to move us along. Verinda, would you put up the slide number 44, I think it is? Oh, I guess we should have Bobby do that. Sorry, he can share his slides in a second. I just wanted to make the point, since I didn't before, that, and hopefully you saw this in folks, as you were talking about this, right? But that really it's about, whatever your sort of particular focus is or expertise or specialty, whether it's mental health or food security, economic mobility, racial justice, that just because they don't have sort of a slice of the portfolio, sort of named, I think sometimes people say, well, where's the mental health slice, right? Or where's the food slice? And it's really to help think about any issue can be framed sort of using this. And it's about how do you think really holistically across all of these different sort of pieces of a portfolio that are necessary about your particular issue, right? So food security can be looked at through every single one of these pieces of the pie, and same with mental health, and same with racial justice. They have to be in every single one. It isn't sort of one piece all by itself. Really is thinking about systems as a whole, and how do you affect systems change across all of these at one time. So I'm going to just sort of make that point clear before we go to the next section. Any last questions? And otherwise I'm going to hand it over to Bobby, and maybe Brenda, I'll let, if you take your slides down, then Bobby can share from his thing. Thank you.
Sorry, those were terrific examples, and they illustrate another sort of interesting feature about the way this framework has been constructed, because it was built like sort of over more than a decade of people who were just like you, who are doing multi-sector, place-based, deeply engaged work, and were frustrated at the way that sometimes the stories of what's being done and what's being contributed, what's the value of this work, get lost as as you sort of layer more and more things together into a region. And so social determinants and burdens of disease reports sometimes don't really capture the nuance of what happens when every single individual is being seen as um, a person who may be receiving life-changing, life-altering urgent services, may be positioned to reconnect with their sense of belonging and civic muscle, and then that gets expressed across other parts of this portfolio. And so we've already seen in these examples we just went through how the integrity of each story stays together, and you can start seeing why a region with dozens of these happening together can start adding up to a much bigger story about the extent to which we're using our assets in ways that are designed to both alleviate affliction but also unlock people's potential for well-being. The next session of our time together here is really getting even more serious about what we mean by investment. If you want to see trajectories of thriving expand to heights that they've never been before, reduce suffering to levels that we haven't seen before, extend life expectancy, all doing that in a sort of a quest for multiracial well-being. The only way to make meaningful change at that level of individual experience is to make significant changes in the drivers that are happening around individuals and with those people as contributors and real architects of this work themselves. And thus, again, we can't repeat it enough. Belonging civic muscle is at the center because it is the people who animate this work who then change the systems that they are a part of. So these four well-being drivers that we're going to talk about now, three of them are kind of depicted in this, this sort of two hemispheres of this diagram, the pie chart. But if we're going to talk about investing time and money and with what consequences over time, we have to get like a step more specific, right? There's the balance of urgent services and vital conditions. There's the special role that belonging civic muscle plays. But we're doing this in a plural environment with unique people who share sort of a common world. And so taking time and effort to invest in making sure that the actions that we take are establishing a system that is fair by design, that also needs to be tracked as a legitimate investment. And if we don't make those investments in fairness, you're going to end up perpetuating, sort of current levels of injustice. There's nothing really exotic about the definition of fairness. It really just explains why do we see any pattern of equitable opportunity or outcomes over time. So, if there's some distribution of food security or, housing security or, access to addiction treatment, what explains whether that is including everybody or excluding some? It really has to turn into an analysis of the system and the extent to which it is built to be fair by design or not. And so if we're going to change those systems, it's really this four-part portfolio that we have to start thinking of as the unit of analysis of our investments. And that's true at an organizational initiative level, but it's also true at a regional level when we start adding up all the things going on in Cincinnati. There is, and I loved Megan's point about, whether you know it or not, whether you're paying attention or not, there's always some net balance of investments. Are they lopsided to urgent services? Are we, really expanding the role for belonging, civic muscle, and fairness and using that as the engine that brings more people in? There's like a story underway about where the net balance of investments are at any level of analysis around these four drivers. So I'm just going to play this 1-minute movie.
The four drivers of well-being are not separate. They work together to drive trends in thriving, struggling, and suffering. Let's look at what produces each of these states of being. It is possible for all people to thrive, but if the conditions are not in place for that to happen, then some will struggle and suffer. People end up suffering when urgent needs are not alleviated. If the supply of urgent services is inadequate to meet demand, then some will suffer. But no amount of urgent services can produce the experience of thriving that comes from having vital conditions and fairness in system design. It also comes from belonging and civic muscle. Social support is healthy, and when fairness expands, it builds inclusion and dignity. All four drivers are essential and must be balanced. In any given moment, however, it is not possible to invest assets in all of them simultaneously at full strength. As circumstances change, you have to decide how best to allocate community assets across these four drivers to find your own path toward renewal. Notice that belonging and civic muscle has a special reinforcing relationship with community assets. When it grows, the total pie of assets also grows. But the other drivers also have critical roles to play. Every 2 years, you and your fellow stewards will have opportunities to either shift or stand by your priority. Consider those choices carefully, because the future depends on the choices you negotiate along the way.
That 2-year phrase refers to an interactive theater that we built that uses this exact framework to play out investment choices as stewards negotiate for themselves how they want to make these investments. But the gist of what we just talked about is kind of important, that you can simplify the immense complexity of the thousands, infinite things that we can invest in into a deeper, simpler story about, is it going to net together in a meaningfully different allocation of assets across all of these four drivers, because they all have a role to play, but they have different functions. And sometimes we miss that because we get very focused on the tactics and the specific operations and activities of every program, and we're missing the deeper dynamics of how our investments are lining up against these four drivers. One of the things that we've also learned from colleagues who've helped shape this framework and are using it in their practice is this commitment to recognize that really wise actions often have multiple benefits. And it takes a lot of courage to become committed, not just as being a narrow sort of focused program leader or a leader on behalf of an issue or an organization, but to think more about being interdependent stewards and multi-solvers, right? And this quote from Beth Sawin, who coined the term multi-solving, talks about the daring imagination that's required, that it might actually be easier to solve our problems together rather than one by one, which is such a beautiful double entendre, because we have too many problems to solve each of them alone. And we might actually be able to solve them together if we're working together more interdependently than we could, if you ever divide them separately. Um, the other nice thing about this framework, when you start looking at it, is that it is not just discretionary cash that is the only or even the most important asset. Belonging civic muscle is one of those phenomenon in the world where it actually grows bigger the more that you use it. It's like, sharing platforms on social media. The more they get used, the more valuable they are. And it's the exchange around those connections that actually builds a bigger asset than we might otherwise have had. And it explains why people who otherwise might have been overlooked or ignored or excluded or oppressed actually are depriving everybody of their genius, of their contributions, of their capacities. And so we're all harmed when we think about assets in very narrow terms. But this framework is basically inviting us to say, how do we track where our money goes, but also where our social connections, our intellectual contributions, our sort of visibility and spiritual connections are all directing somewhere around this framework. And you can just see it in the pictures of colleagues, this one from a neighborhood in Wilmington, Delaware, who have been organizing around vital conditions as part of their revitalization plan. And this image is not is not uncommon for people of all different walks of life to be able to see the backdrop of what they're doing, now told in the story of how together are we establishing the vital conditions that we care about, and being present enough to people with adversity in our midst who need, sort of crisis support and others to wrap themselves around them in moments of adversity. You can see it in conferences where people come from different walks of life and different arenas and saying, what's going to be the next big move for our community? Well, the backdrop of these vital conditions and urgent services is often just enough of a scaffolding for people to see that it's going to take everybody, and we're going to have to make some pretty significant commitments to change the proportions of these investments if we want to see very different outcomes going into the future. Healthy Communities Delaware, not all communities, have been doing this work at the statewide scale that they have. But I love the array of things that they're doing with this tool. They've everywhere from, frameworks that have introduced people to, the value of community organizing, to aligning what are the statewide health improvement investments around a specific set of multi-solvers, 6 multi-solvers that they have workshopped together with hundreds of contributors to say, if we as a state start investing in, a handful of actions, we're going to see benefits that are sweeping across the board here. And that means organizing our data systems differently, connecting with youth differently. And it's really no surprise that when you start having those inclusive conversations, assets start flowing into this work in ways that matter significantly. And we've seen the, Healthy Communities budget, get much bigger because they're managing a much bigger operation of people with more and more assets to bring into this work. So I guess we're going to go into another little group discussion here, but I'll just offer this sketch that, Verinda started our conversation today with the idea that we're going to need a rising movement, a movement that's oriented around this expectation of everyone thriving together. But we don't live in a world that's built for that at the moment. So we need stewards to step into this work and to be able to, sort of orchestrate their own path around the engines of growth that are causing more and more people to join in this work. But we have to be realistic about the inertia and the opposition that stands in our way. And so this little graphic has been, one way that we've found to tell the story about what we're experiencing in communities across the country. The key thing, and I have seen this firsthand, is, when we are indeed living in polarized and divided times, but what we also have going for us is dissatisfaction with the status quo. Not many people want to keep living in the world that we are seeing every day. They just don't necessarily know what to do next, or with whom, or how to make productive, sort of progress toward a future that they would value, and one that, includes them, um, and their dignity and their families' well-being. So shared dissatisfaction with the status quo can be a major asset as we start norming on the expectation of a future with everyone, built for everyone to thrive together. That opens the path for more people to join as stewards. And one of the things that we hear in our work frequently is, I didn't know other people shared my values. And when you start connecting with other people who say, yeah, here's what I'm doing, and tell stories of what others are doing, and who do we next need with us to make the next big stride, you start thinking of that growth of shared stewardship as one of these engines of progress. But it can only take us so far, because savvy stewards are going to recognize that systems are not built the way that they could be or ought to be, and so there is a need to break from the status quo, and that takes courage. And that means courage just to do things differently in your own organization, to form partnerships with people you haven't had before, to embrace new ways of thinking and working. Like, it all takes courage. Even change for the better has to overcome the fear of change. And to the extent that we can, sort of confront that fear, that's a good thing. But if we can't, if we aren't able to really leave some things behind, or sort of to let go of some of the routine ways that business gets done and embrace different ways of working together, we're going to perpetuate sort of the current harms of systemic injustice. So the question here, really, at the end of the day, is, are we going to maintain levels of current segregation around who's thriving and who's struggling and suffering, and who enjoys meaningful work and wealth and who doesn't? And like, every one of these vital conditions and urgent services can tell the story of segregation or solidarity. And that's a big part of what it means to develop the courage to change. As we think about that, it really is about will building, about seeing and believing in the possibility that more of us can actually connect to do the work to establish systems that are fair by design. And the poll that we took at the top of this webinar was really inspiring, right? Like, a couple people skeptical, don't think it's going to happen, but and I'm skeptical on some days too, but we don't have to be trapped in that skepticism if there are optimists among us who see and believe that we can build the will to make this happen. And doing that energy work to overcome the fear of change is kind of job one. And the minute we can get that energy working in our favor, then we're going to start seeing significant investments in vital conditions, more assets flowing into those things that bring people in and tell them that, yes, this is the simple rules that, the folks in Palm Beach discovered very early on. It doesn't take money. It takes a willingness to connect to new people in new ways, first and foremost. And the minute you start getting that engine going, now we have even more capacity to do the harder stuff, which is building a system, that really truly is fair by design, which of course is going to bring even more people in. So these are very reinforcing dynamics, but they're all limited by our courage to do this work. So that's our question for the next, let's say, 10 minutes or more, is what opportunities and obstacles do you see here in Greater Cincinnati to do this kind of generational investment, to have the courage to break from business as usual? So this is kind of like an open discussion. We won't go into breakouts, but this is an extended family of real champions here, and you're seeing different things about what the landscape of opportunities and obstacles look like. So we'd love you to share what you're seeing from your point of view. I will stop the screen share just so I can see more of you
Yeah,
at once.
can I jump in?
Yeah, please go ahead.
Again, my name is Dee Kinney, and I just want to say, as busy as I am, I thought I need to attend this webinar. It just spoke to me, and I'm so glad that I did, because even though I'm working as a co-chair of the Regionals Health Steering Committee, I at times feel like I'm the only one, including administration, that really cares to create this community for fostering, well-being, and community for fostering belonging. And doing my research, if y'all research, that can be a lonely situation as well. And yesterday I was doing some kind of research, writing a paper for publication, and the sites that I typically rely on, the CDC, the NIH, page not found, and one blatantly just had they'd taken it down. The Surgeon General's report on mental health from 23, they just took it off the website and put it back on, but they archived it. And the only reason they put it back on is the message at the top of the screen was saying that it was court ordered to put it back up, and that the current administration just simply doesn't believe in it. So they're just going to tuck it away in the archive. So that, in addition to I'm so happy I attended today, and I no longer feel alone. So I think that's part of what you're talking about.
I love it. And it's one of the properties of an oppressive system is that it makes you think that all you can do is the tyranny of the urgent, and and of course playing into that dynamic is the surest way to produce a future with more people struggling and suffering. So it is an act of courage and resistance and real imagination to be able to make even a brief amount of time to say, I'm not going to play into the dynamic that says I can't even think about anything bigger than today. And of course, a lot of people are trapped in that reality because we're living in a system that doesn't give people a lot of room to breathe or to dream or to feel like their lives or the lives of the people and places they love can be significantly better than they are now. Everything in our data tells us that that is possible, but we have to be able to create spaces that balance this. And that's a big part of this idea of balancing investment. It begins with investments of time and energy first and foremost. And there are a lot of forces that want to distract and keep people, in fear, which again is going to suppress our full potential. I love it. Thank you so much, Dee. And I know if you have to go early, you've already contributed immensely to this discussion. Others, what are you seeing and feeling? Not everybody walks the same walk here.
Hi, this is Rashida Manuel with Planned Parenthood, Southwest Ohio. I think one of the opportunities right now, it's an opportunity slash challenge, is everything that we've been seeing and talking about just in the last comment around equity and inclusion and how that's been demonized and kind of pushed out of the conversation. And so I think when it comes to thinking about well-being and thinking about the vital conditions, it's imperative that we understand how we got to where we are right now and what do we need to do differently so that we don't repeat those things again. And I think that because we have the conversations around equity, inclusion, diversity have become, almost taboo in a way, in a sense, to talk about those things, then it becomes we're silencing that conversation. And I think that it's an opportunity for us to not to shy away from it and to continue to find ways and opportunities to have those discussions and to continue the education for folks so that they understand when they're thinking about investing and they're thinking about, ways to spend their own time and money and resources, understanding kind of I guess the role that equity and inclusion plays into that. I don't want that piece to be lost, and I think that that's something that's happening, that's at risk of happening right now. And I think it's a conversation that we have to continue as long as we want to see thriving communities and vital spaces. So that's just something that's been on my mind lately.
Yeah, it's a great point. And I love the personal layer that you added into that, right? I mean, it really is starting with where we show up and who we're paying attention to that then starts aggregating up. And lots of times when we do stewardship assessments, there's the question of how much am I practicing in the ways that matter here as an individual? And it's a separate question. Does my organization do that? And then like another question is, and how much do we do that across our organizational boundaries? So if we think about this work proceeding at three levels, you've always got your own choices. Where do you show up? What do you do? Where are you making your investments? Again, expressed through this portfolio. But then how do we design organizations that allow our full our full values to shine through. Often organizations present a lot of inertia. There's old ways of doing business. There's always somebody who's, kind of sees the world differently. And so aligning within an organization is a whole task. The inside game of organizing is a whole thing. And we're dealing with, Interact for Health is a perfect example of a foundation that has a history of old ways of doing philanthropy that are now actually experimenting with new frontiers, new language in order to do new and bigger and more, more significant work together, in a quest for an unfinished agenda. So we've got a story of institutional evolution, and then the minute an institution starts moving in this direction, no wonder you have to start partnering with other people differently. You reach across the organizational boundaries and start discovering that we can do more together. It cannot be one philanthropy that, no matter how brilliant or innovative or generous or creative, you're going to need a whole community of players who want to move in this direction. That becomes the question of, what's going to be the path that Cincinnati follows into a more equitable future. Thank you so much, Rashida. It was
Thank you. And I just want to actually, what you said just sparked another thought for me. I think it's also important for us as nonprofits and as organizations that are receiving funding, that we, when you're looking at this framework that you all have presented, it encourages us to look at the well-being of the community collectively and not just from the purview of our nonprofit individually. And so I think for me, it's about how do we build an ecosystem of organizations that are able to create that environment that allows people to thrive. And so that means as organizations, we have to expand our way of thinking and operating so that it's not that we are competing with other organizations for finite funds, but rather how do we work collaboratively with those organizations in a way that benefits the wider community?
Yeah, that's right. And so we're even hearing this in the discussion right now on this call, where we can talk broadly about, regions and population levels of well-being metrics and ecosystems, but we can also talk very pragmatically of who's doing what work with whom, where, and what's it producing in terms of the concrete experiences that people, that define the life experiences that people have around urgent services and vital conditions. And so there just aren't that many organizing frameworks out there that would cover that space, the conceptual system view, but also the practical work of who's doing what and what's it producing for folks. We have a few more minutes for this discussion, and this is really what the richness of a community, thinking together is about. So if we have others who have thoughts to share, I would love to hear them.
I'm actually glad that Rashida. Hi, I'm Stephanie from Planned Parenthood as well. So Bobby, you had also talked about it as well too, and Rashida just talked about it. But some challenges that we have faced at Planned Parenthood, I do outreach work. It's just outreach, that partnership work for us at Planned Parenthood, because that name is so politicized that it only gives other agencies the opportunity to look at us, I say, through a straw. But what we want to do is pull that focus back and be able to shine more light, because we do provide abortion services. And that's a small percentage of our services, because it's so focused on and so politicized that other 95% is overshadowed by that 5%. So partnership is super hard, for us. One thing that I have been challenging, not only just our own organization, but other organizations as well too, is that it's reproductive health care. And this is important for all of us. This is something that is intersectional among every different SDOH, all communities, all backgrounds, all colors. So what we have to do is not take a look at these relationships as a personalized, viewpoint, but as a community viewpoint. So I see a challenge for like Planned Parenthood in Cincinnati is just that relationship building. I have been saying over this past few years is that what we want to do is go from a mistress to a wife role. And what that takes is for other people partnering with us and being more outspoken with, hey, I do support Planned Parenthood, and this is how they fit into our ecosystem.
Yeah, it's a really interesting observation when we skip over the values, and go right to the tactics. People can often have a food fight over a particular service or policy or practice. But if you take the time to say, what kind of a community do we want to live in, right? Where are we going together and who's coming with us around this? How do we sort of stand ready to receive anybody who needs help in whatever walk of life, and make, abortions rare, make thriving families common, but like that's been part of the rhetoric in reproductive health for decades, but the practice, I don't know, your particular chapter, but I spent 7 years in reproductive health at CDC with a bird's eye view of what this was like in the country. And it was infuriating how much, we got it sort of created our own confusion and controversy without actually establishing the humanity that governs the whole thing. And it's one of these ironies that we do public health, health service, human service work, but it's done often bureaucratically and technocratically without actually bringing space for the shared humanity around this. And, that was exactly some of the literal words we heard from our IFH colleagues at the top of this call. If we can bring the humanity back in this work, we will discover, and then there's some decent communication science backing this up, that people might agree to compromise on things if they know that the shared humanity is the undergirding value, and the pragmatism that says we are not a perfect community, but we can make, we can move toward a future that is ever more perfect, right? That's been the American ethos that we've been, frankly, the progressive left has skipped over. And, so I have a lot of optimism that frameworks like this, built from the frustration of years of skipping over this stuff, that's why, all of the adjectives in this framework are they're normative things, right? We don't just talk about housing. We're talking about humane housing. We're talking about meaningful work and wealth, right? What does that really mean is opening up space for people to have a discussion about what they value. Anyway, that was more than I would plan to say in this discussion, but it's, both you and Rashida have really struck a chord, like a personal chord with me, because it's exactly the frontier that can flip these sort of old controversies into new arenas for concerted action. Um, thank you. We do have more time on the clock here, so others in this space, please share.
I'd like to talk about food insecurity for a moment or two. Anna mentioned it and the possibility that it is at the base of some things and almost like a prerequisite. And so one of the charts we've not looked at is the Maslow's hierarchy chart, which would be as a triangle. And at the bottom is food. And we may be ignoring that. We're in a city, Cincinnati is a city that has a lot of Black residents, citizens. And when you look at the US Census Bureau data for not enough to eat, going back to last September 2024, 28% of Black households with children reported not enough to eat. I think that that is something that is one of the urgent things that we've got to figure out how to fit the other things into it. But without addressing that, we are going to have, well, we have terrible third grade reading results for all of Cincinnati's not enough to eat, white, Black, and Hispanic. And as third grade reading goes, so goes the graduation from high school. And as graduation from high school goes, so goes the incarceration percentages. More than 50% of incarcerated folks in the United States failed to pass high school graduation. I think so. That's one thing I want to set out as being a prerequisite. How do you feel about that, Bobby?
Yeah, it's a great example. One of the phrases we use is, for a framework that's built to be interdependent, you can start anywhere and go everywhere. And food is one of those classic multi-solvers where, because it is so universal, everybody's you know, gotta have sort of a minimal level of food. but it also expresses cultural ways. It's connected to how do we produce and distribute food. There's just no stopping rule to the potential gateway, sort of activities that happen when food and food security is your guiding ethos. And I'll put in the chat a short little article that describes and uses food as an example of a multi-solver, and how each one of the 7 vital conditions is probably necessary to achieve what we mean by, a healthy, equitable, sustainable food system. And since you mentioned Maslow, I have a favorite article that Maslow's triangle is often perceived as we can't do the upper things until we do the bottom thing. But that isn't really exactly how Maslow himself understood it, and it sort of implies that it can lapse into the idea that we only have the urgent things of immediate sort of biological need. But when you start recognizing this, and self-actualization is like a luxury that happens only when after that other stuff has happened, it isn't quite that dichotomous. And we've got belonging and civic muscle at the center of this, because people really need to be the ones that change systems that actually are capable of meeting our material needs in new ways. And so if you're really getting down to the concrete realities of how do mere mortals change really entrenched inequitable systems, you can't just leave self-actualization to a luxury at the end. It's got to be in people's self-interest to create a more loving and caring society. And everybody has that interest. We've lost touch with that. Anna, made this point, but, if love is what justice looks like in public, these vital conditions are a decent definition of what that love should look and feel like. And food is a terrific way of demonstrating that. And then it's going to be the gateway to do even more.
Thank you. That's fantastic. One of the things is we were doing a program which was a survive program, and then we found out from the feedback that 24% of our people were saying doing better at work or school. And so we're hoping that that's the indication of a thriving, which is, although they haven't yet solved their complete food insecurity problem, they're still feeling like they're doing better at work or school. I'd like to look at the 2 things that you're suggesting. Thanks, Bobby. That's great.
Yeah. Yeah. Yeah, and we don't have to have a tug of war over this, right? Other people work on housing first, and they make legitimately an argument that housing is, the stability that allows people to engage in recovery and all the rest. So these constituencies that historically have been organizing around different disease or body part or risk factor groups or population groups. It is the fragmentation of the ways in which we've organized our, kind of social change investments that are often the obstacle that we have to get, into a more creative space. And it's just that shift of asking, what if we acted more like interdependent stewards? What if we admit that what we're doing is, pursuing multi-solving actions? And so whatever the funded or intended benefits of your organization are, I can almost promise you that there are co-benefits in other areas that maybe are going unrecognized or uncounted. We can talk about measurement on this call if you'd like, but it is often what gets funded and measured is what matters, and we skip over all these co-benefits that happen when really well-designed system action is happening. And that's one of the reasons why I don't think, food, can often be seen as the food bank rather than designing a food system for an entire region that includes a food bank for people who need it, but also has a lot more to the story. So Tony, it's a really rich comment. Thank you. I'm loving this discussion. I'm seeing lots of heads nod. So if let's keep this going for a few more minutes if folks have things on your mind.
Tony,
Including stuff that makes this hard. That's all fair game. Kate, go ahead.
Yeah, we're so one of the things I love about Cincinnati is we do have, in certain instances, a fair bit of collective action muscle and interest, and big movement now working around youth mental health, where there's a lot of willingness to change and challenge the status quo, some resources to start with. I feel like one of the hardest parts is deciding like where to start because of the scarcity of mindset that we have limited resources, and by choosing to start in one area, there's 15, 20 good ideas. and it almost feels like you're valuing one area over another. And then, so I'm just curious, in all the communities that you've worked on where you have alignment on vision, any sort of best practices, things that you've seen that have helped in that deciding of where to begin, because that minimizes, the scarcity mindset, or that we're choosing one versus another and devaluing something else.
Yeah, I love the way you frame that question, because the premise of where to begin partly depends on your capacity to do one or more than one thing at a time. And so if there's a real scarcity mindset, absolutely, you've got to be really disciplined about what you're going to do and what you're going to do first. Um, one of the phrases that organizers use all the time is you don't want to lead people into failure, right? So you don't want to have a wish list of policies and programs that you want to change, and try to sort of strive to make sweeping consequences with a very small number of people and organizations and assets that you're just kind of hopelessly outmatched. And what you're doing is pursuing a wish list, but not an action agenda. And so being realistic about what you're capable of doing is kind of job one, and pairing that up with what you would like to see change in the world, or what, where there's momentum, then what's the next adjacent action, and who do we need with us to be able to make that action happen. That's a different, more generative kind of way of framing the question, because you keep your aspirations and your capabilities in sync with each other, and you're growing over time. So this is, if anything, this is a growth and developmental framework, just like America itself, right? We're an imperfect, you know, unfulfilled promise of what life in America can be like, but it takes each generation building their capacities to make the next great stride. And so aspirations and capabilities travel together. And so now we come to this idea that, and it happened really quickly in that little 1-minute movie, but when you start investing in belonging civic muscle, it starts growing your pool of assets faster than anything else you can do, right? It's that old phrase, right? I'm too busy to get help. Well, that's a big mistake, right? If you're leaving people on the sidelines or putting them on the sidelines, you're depriving everybody of assets that, could matter. And so kind of the first job of breaking out of the scarcity mindset is recognizing that we have more assets in our midst than we even know. And so bringing the bigger we, um, yes, they're going to come with their own agenda, and some people want to start with food and others will want to start with housing, so you'll end up with a prioritization problem when you bring more people in. But if you're organizing around pragmatic action and shared values, people can make, reasonable compromises about where to start, knowing that it's not a one issue agenda. It's not a program or a project. This is a movement where people are being invited to do their part in something that is, going to grow up into a much bigger story. The last thing I'll say about this is I had this conversation with it was a multi-sector partnership in Rhode Island, and they were fully committed to an economic development agenda, and they could not decide whether they were trying to build better jobs for the people in this region right now, or whether they were trying to create a different kind of economy to attract new people into the region. And it was like, better jobs for people here versus new jobs for everybody with newcomers. And it was paralyzing them. They weren't doing either very well. And it was, it was recognizing that, is it a different cast of characters who are pursuing these different complementary economic agendas? How do we show up for each other and applaud for actions that are not our own, while waking up on Monday and doing our part? That kind of solidarity across issue areas is one of those places of courage, right? When's the last time we saw hospitals, showing up to applaud the school budget? Or you get the point, right? People stay in their swim lanes because it creates a sense of security, but it also reinforces the scarcity of everybody doing their part, and this issue of prioritization becomes even harder. So that's kind of my quick reaction to that question. Is it's actually a lot easier if you start admitting that the power of belonging civic muscle can unlock our ability to do more things at once, especially if we're committed to doing them fairly. Now, suddenly you've got a lot of people who can do more than one thing at a time. and you have to show up for each other. Okay, time's a ticking here. Maybe let me go through just one last little thing. It's an offering that will kind of leave behind that may be useful to you, and we can have a little bit more discussion at the very end. So thank you for sharing what you see. This is a good question to keep asking yourself, ask your colleagues in your own organizations and even across organizations. This landscape of opportunities and obstacles is always changing. And the big question is, are we poised to make, what's our next big move here? And who are we going to need with us to make that happen? If you're the sort of person who, got kind of different things out of different parts of today's session, it may be helpful to have like a little connect the dot diagram. I tend to think of this work in visual terms, and I need a map to kind of keep it all in view. Otherwise, I can end up losing sight of some of the key pieces of this work. And so this diagram has been built with hundreds of colleagues over years. And it's been pretty reliable as a way of connecting the major dots. So if we're involved in a quest for everyone to thrive together, we know that has to happen by establishing vital conditions, right? There's no way to urgent service our way to thriving. Those urgent services are necessary because lots of people are struggling and suffering because they're living lives that are marked by adversity and urgent need. And so those two things are in constant play and tension with each other. And they can reinforce, there's kind of a dynamic between them. The more vital conditions we establish, the less urgent adversity and urgent need there's going to be, and vice versa. If we underinvest or divest from vital conditions, we're going to end up with a lot more people who are experiencing struggling and suffering. This gets a lot easier if we're not talking in vague euphemisms about social determinants or, just talking about vital conditions broadly. But if we're getting pretty specific, right, let's name the vital conditions that we most want to produce. Mostly in communities that I've visited and, the research literature, it spends most of the time talking about what we want to stop or prevent or avoid, not what we want to create and what we value. What do we really want to build? So this vital conditions framework, even if you don't love every piece of it, it's trying to be very specific about what we value, what we want to create, not what we want to stop. It gets richer when we juxtapose it with the urgent services because those are real and they're in a dynamic tension with each other. So having the full portfolio in view is like a pretty sophisticated level of clarity that lets you play in a multi-sector, sort of concerted action arena. It doesn't take long before people start doing this work to recognize that vital conditions and urgent services, they all tell the story of our legacies for living together, right? We are unique people in a common world, and we have a twin, some would say schizophrenic capacity to express legacies that are sort of conveying dignity and inclusion. And there are places in American history that will demonstrate, really significant strides toward legacies that are built for living together. They expand a commonwealth and bring more and more people into the circle of human concern. And we have legacies that do exactly the opposite. That are often done in backlash against great strides toward equity and justice. Now we can end up with legacies that are inflicting trauma and exclusion, and are tearing at that sense of belonging, right? They're othering. They're based on some people thriving and some people's lives matter and others don't. So that this dynamic of these two legacies really can also be sort of entrenched in our economy. If we're expecting large numbers of people to be struggling and suffering, we can drift into the idea that our assets, our economy, should really be built around like the best we can do is deliver urgent services to people in need. And we have to reject that presumption, right? There's a lot more that we can do than just merely deliver urgent services to a deserving few, right? We can build an economy that is going to value people's well-being and start investing in the vital conditions that produce it. This is a worldwide conversation about the development of a well-being economy. And, the current extractive forms of sort of old style capitalism can never really unlock our full potential. So we're going to have to embrace moves toward a well-being economy somehow. And this is giving us some concrete sense of what that looks like. It's not going to happen all at once, but it happens piece by piece as we start investing in the things that we really want to create together. And our conversation with the folks from Planned Parenthood is a perfect example of an economy that actually values people's well-being is going to be great for families. It's going to be great for reproductive justice. It's going to make abortions very rare. But it means a whole macroeconomic shift that actually is about well-being as the guiding force, not who's delivering crisis services to a handful of people. Anyway, you get the picture there. So this becomes practical because it's the work of stewardship, right? And stewardship in the north half of this diagram is, the art of expressing love. Mostly what is happening in communities across the country is a lot of adversity and urgent need and skepticism or fear that it's even possible to sort of move in the direction we're talking about. And so that is the work of healing, right? Standing with people in pain or in confusion and saying we can heal together. It is not broken people, but a dysfunctional system that we're working in that is making the prospects for well-being so uncommon. And so this twin commitment to love and healing is really the way that we think shared stewardship can become a much more rising norm, right? And the animating force that says how can we navigate toward this North Star of thriving together. So that's it. This one picture animated in a couple steps, but it's like I look at this 3 times a week to try to make sense of where are we, in any given community engagement, but where are we as a nation in the intergenerational story of our quest to thrive together? And are we being, great stewards in that work, right? Are we expressing that love and healing in every interaction? And are we, sort of moving from an over-reliance on the bottom half of this dynamic, which is still humane and important, but there's just so much more we can do on the top half. So let me stop there, see if that helps or if it raises any other questions. And we've got a couple concluding polls which we want to take a moment for. But if there's any final observations about what you're feeling from today, we'd love to hear.
Cool. I can wrap us up.
Yeah, great. Go ahead, Ashley.
Yeah. Well, thank you all so much for joining us today. Thank you, the Rippel team, for this conversation. I think it's just such a great reminder that in this midst of chaos, there is still opportunity for us to connect. I think the thing that I'm taking away with me is around legacy. We talked a lot around legacy, and a lot of the work that we're doing today is about creating our legacy and our community legacy. And we have this unique opportunity to do that. And so thank you all for joining us today. Just a couple housekeeping items before we close out. We do currently have 2 open RFPs. We have our Rural Changemaker RFP and our Local Health Policy, which are both centered around vital conditions. Please make sure that you keep an eye out for our Health Watch newsletter for announcement about future in-person and opportunities around with the Rippel team and around vital conditions. And before you guys go, Bobby mentioned this, but we do have a short little poll on the screen that we want to do to get your feedback for today's session. And so thank you all again so much for joining us this afternoon, and hopefully you'll get a chance to enjoy the beautiful weather today.